Director's report. Director Wheelan.
Sure. We have a few things. Let's go ahead and start off with, as Yolanda calls them, the dynamic duo.
All right.
Stephen and Fadi, our chief scientific strategist and our epidemiologist. I know that they were, we have been doing a road show, and they presented to the City of Fountain Council last night. And if you want to give us a quick update and probably a update around the Delta and what that looks like, and we'll go from there.
Thanks very much. The Fadi and Stephen show here. So go ahead. First of all, I'd like to talk about a couple of milestones. You've heard from us over a period of months and a year, but now the first thing is the most spectacular accomplishment when you think about vaccines, and we have an amazing set of version 1.0 vaccines out there. In 6 months, we've actually fully inoculated more than half of the eligible population in El Paso County. So that's a testament to an amazing effort on the part of a manifold set of talents and people. So I don't want that to go by the wayside because you're hearing the nation isn't going to make the 70%, Colorado isn't going to make 75%, but 50%. And the number is actually a little bit above that, and that includes federal estimates. So that's a spectacular accomplishment, and we're seeing the results. The second thing is if you look at the state of Colorado, you look at El Paso County, we were a little bit late to the show in terms of the decreasing cases across the nation, but we are now actually at the lowest incidence rate since we've seen during the fall surge in the first week of October. So this is a pretty spectacular accomplishment. Our 1-week incident numbers came down in early June to just above 100 and did not budge. We were disappointed, but we've now gone below that. So that's another accomplishment. Generally, the disease is a little bit in retreat right now in the United States of America, which is a pretty fascinating thing, and also in the state of Colorado. So that's since October. So that's just an astonishing thing. So both of these are astonishing things. Next slide, please.
We wanted to update you about the correlation between vaccination rates and incidence. El Paso County's incidence is going downward. In fact, the last time we spoke, the last Board of Health meeting, we've decreased by at least half of what it used to be during that meeting. So that's the good news. The cautionary news is that El Paso County's incidence remains higher than the other 9 most populous counties. And we are seeing a bit of a correlation between counties that have higher vaccination rates and a lower incidence. So generally, everybody's moving in the right direction. El Paso County is a little bit slower than the other counties. And for example, if we look at Boulder, their incidence right now is less than 10. They're in the single digits. So we want to make sure that our county, alongside the other counties, continue this downward dive. Next slide, please.
And the final slide, there's a couple trends going on. We're actually at a point in time, again, in aggregate, the disease is moving down. We do believe that there's going to be a predictive value of the vaccination rates in terms of looking at disease. But remember, if you look at different levels, you'll see different pictures. So across the United States of America, we're going to see a puzzle forming. On one side right now in Colorado, the weather is on our side. So both the weather, improved ventilation, it's really good to help knock things down. The vaccinations and previous natural immunity from infections are on our side. One of the things that's moving against us are the variants. And this is a picture, it's quite a nice picture. It's just an example, it's a little bit hard to measure, but recently WHO renamed the way we talk about variants. So if you look on this slide, we're showing variants of concern. Only in the last week or so has the CDC added the Delta variant as a variant of concern. If you recall, Alpha, we used to know as the UK variant. Delta, we used to know as the Indian variant. And what you can see now, this is a picture from the state of Colorado, and what they're showing is they're actually taking some set of samples and sequencing them. So it's an imprecise image, but what we're seeing is very rapidly, Alpha had been the dominant strain, the dominant variant, but that dominance is now being threatened by the even more transmissible Delta. And even though it's a little bit hard to measure, you've heard that Delta is rapidly increasing. And in the state of Colorado, Delta is well represented, more so than in many states in the United States of America, and it is bound to become the dominant variant. Of course, the risk with Delta fundamentally is that it's more infectious, and that's how it's dominating. So that is one of the things that's going against us. And again, the best protection against these variants is to be fully vaccinated. And that's why it's imperative that not only do we vaccinate as many people as possible, that they complete their course of vaccination. Again, we mentioned earlier in the meeting about the state having a program to help try to complete the vaccinations and make sure everybody has access to both doses. Again, the way that our vaccines have rolled out is we really have two-dose vaccines that are the most common. So it's important that people receive both doses. The single-dose vaccine is not in great supply, as you know, so we're not using it as much as before. Questions, or we promise to be brief.
So,
Yeah,
I have a question.
We do. Please, go ahead.
you know, in the fall, I know you're probably looking towards the fall because we're going to encourage people to get their influenza vaccines, Pneumovax, and all of those kinds of things. When do you expect that? Will it be like a year after, like when I've been vaccinated, that I'd get a booster? I mean, do you have an idea about how that's going to work and what the strategy is going to be to communicate that to the public? And
I think that's a fantastic question, and one that a lot of people are working on right now to understand, you know, whether and when a boost of vaccination will be necessary. I don't think the science is settled yet, and there are a lot of research programs right now trying to understand how long the immunity is going to last from the vaccines, and how the variants fare, and whether or not the variants can be breaking through the existing fleet of vaccines. So I don't think we have an answer to that one yet.
I had a question. If we could roll back one slide, please. Okay, this is my least favorite slide, and you know I'm a chronic worrier.
Yes.
So I think best guess, of course, is that COVID-19 is seasonal, and we know that it does replicate more easily indoors and less easily out of doors. So in the spirit of anticipating, what would you say is the likely circumstance? I know our incidence is going down, but we still have a lot of our county that's not vaccinated. So a large susceptible population.
Right.
Try and put on your predictor hat here and tell us what it's going to be like in El Paso County in November if our percent of vaccination doesn't change.
I think the keyword there is a susceptible pool. We talked about the eligible population that has been vaccinated. Now we're flipping and we'll talk about the eligible population that could get infected. And the higher that number is, and the higher we're coming off, the more people that will be susceptible. And unfortunately, it is all about the numbers. We are coming up on the July 4th deadline, and we don't want to lose track of the effort and the accomplishments, but all it comes down to is the individual risk of getting infected. And the more people we have in that pool, the higher that dot is going to be in the fall.
Okay.
And I think you're exactly right. If you think about the evolutionary, the way viruses work, it's a lot like a water leak. They're gonna find the most susceptible set of populations, and we are large, and this chart tells you we are susceptible.
Yeah.
So it's important that we continue our efforts to get people
Right.
vaccinated before the weather changes, the fall comes on, and we do anticipate that there'll be more disease because of moving indoors and exchanging.
Thank you. I like your buttons too. All right.
Vaccinated.
Board member comments. Yes, Doris.
Susan, at the last board meeting, we talked about the primary care physicians and other physicians, you know, trying to encourage their patients to get vaccinations. What has been done on that front? Anything yet? I know it's only been a month since we met, so because they were saying that some of the physicians themselves and healthcare workers were not wanting to get them, and so I mean there was that conversation around that. Dr. Vu, if you have anything to share.
I don't have any new insights into that. It's a problem both in our practice and my observation outside of our practice, and I don't have a good idea of how to fix that problem. Vaccine has been available for several months, and most providers who are still hesitant have had enough time to think about it. And if they're still hesitant now, there must be a good way. I just don't know what the way is to convince those providers.
And you know, what I've heard, you know, in some of the statewide calls that I've been on with primary care providers is that they were concerned about waste and some of the requirements, but now the state health department has come out and essentially said, don't worry about waste because there's enough supply. So you can puncture the vials, and if you have people that are interested in getting vaccinated, vaccinate them. And there are initiatives that are happening as it relates to educating the physician offices on processes as it relates to engaging with their clients to get them vaccinated. And so those efforts are steady and they're going on, but I do think that that's always a work in progress too. And we know from some of the studies that have been shared that people trust their primary care provider offices. And we've been increasing access to vaccine. That's been a major initiative throughout the county. And I think that we've been doing a very good job on that, but we know that there's not a one size that fits all. So mass vaccination is not going to work for everyone. So a close relationship with, your individual doctor and having that conversation, will be another area that I believe that people will seek out and be able to get access to the vaccine. And Deanne's going to talk a little bit about where the plans for mass vaccination, because there's going to be a devolving or demobilization of the World Arena mass vaccination on the 28th of this month. And so the last day for that mass vaccination site will be the 27th. But we have some other plans in the works. We're continually navigating and strategizing with our vaccine consortium on where to go, what tactics to utilize to provide vaccine, but to get innovative. And I think there's so many different ways that we have to work on, but that's something working with provider offices will continue.
Susan, if I may, one factoid, 50% of the population doesn't sound like that's fully vaccinated, but that's more than 630,000 vaccines delivered, individual doses, which is pretty amazing. And then also to your question about time is on our side as more people become comfortable with watching vaccinations and the safety profiles become more evident and versus the risk of not being vaccinated. That's on our side. The other thing is that when the vaccines become fully approved, and we do believe that that's going to be happening in the next several months, as well as the Moderna vaccine becoming potentially available for the younger people, which has a less restrictive cold chain. So these are all things that are going to play into availability of vaccinations.
When do you think it'll get the official approval?
Which one?
Okay, the process for each of them.
Oh,
Pfizer, Moderna.
Yeah, so the full approval, both Pfizer was first because they were the first vaccine.
Have they been fully approved?
They have not been fully approved, and that typically takes several months. I mean, and during normal times, but these are not normal times, so we don't know what to expect. And then also Moderna just recently applied after the close of their clinical trial with the 12 and up age range. But again, those processes are sort of competing processes. And I don't think we have any sense yet. Deanne, are you familiar with the latest on that? But we're talking months.
A month? Before the fall?
Yeah.
It's hard to say, but I think it must have been a news article, but they're talking about 3 to 5 months. But that all can change based on.
And then there's another one is just approval in general for younger ages still, and that's a major that will be a major breakthrough when that occurs. Of course, that's a much more challenging calculation, from the standpoint of safety and recommendations.
I think that will make a big difference.
Make a huge difference. But so there are a lot of things moving in our favor, and generally people, as time goes by, they start to understand there's more acceptance of, and the questions are getting answered, and they're genuine questions. I mean, there are people who have genuine concerns and questions. By the way, presently, most of our vaccinations are actually occurring in pharmacies, which is fascinating because people know about pharmacies and they're ubiquitous. So they're getting their vaccines in pharmacies.
Good. One more question. Let's see. Ted Colas, please.
First of all, I want to thank Fadi and Stephen. It's always fascinating to get their information. And I appreciate the approach. There's a lot of negative press about El Paso County only being in the 50s when other counties in the state are in the 70s. But the 50s and the amount of 50 percentile in the amount of time that we have had this vaccine is truly a remarkable feat. And I appreciate the positive energy going into recognizing that. while it might be lower than other counties, it's still very high percentage in a short amount of time. That said, I think some of the hesitancy with vaccination had to do with how rapidly these vaccines were developed. Now, though, we have had the vaccines in arms of people, myself included, for over 6 months. We aren't seeing any negative outcomes. We're not seeing people getting sick or things like that. And that might be something that we can capitalize on now in another effort to try to get a second wave, to tell people, you know, after 6 months, we're not seeing these things that some folks were fearful of because of how fast the vaccine was developed. And if we can maybe come up with some statistics, and I know that the statistics are out there regarding how many people the illness, lack of illness in those people who have been vaccinated, for one, and for two, the lack of any long-term side effects from the vaccine now that it's been 6 months and growing, 7 months, that it's been available to the general public. That might encourage more people who have been hesitant because of just how fast the vaccine was developed initially.
No, I agree. That's a really excellent point, and we're on the case.
Well said, Ted. More diplomatic than I would have phrased it. Okay. Any other? Yes, Cami.
Sorry, I'll be super quick. You know, long before COVID, we would have been looking at a very similar chart for El Paso County, like preschool child age vaccination rates. And we do know that El Paso County is behind the curve, and there's a tremendous amount of hesitancy in our county in particular on regular vaccinations that have long been around. So I feel like, I mean, yes, this is a scary chart, as you said, but I would guess that it's very similar in consistency to what we see with overall vaccine hesitancy in those that have been around for a long time among El Paso County residents. So I think this is just to be honest with you, it's a continued conversation about how do we address overall vaccine hesitancy, not just the newest.
How do we think about vaccines? Right.
And that's a great point, if I may. I mean, one of the challenges with vaccines is that when they're successful, they make the risk of disease fall away in your mind. So people simply look at the risk of side effect, which is extraordinarily low with well-designed vaccines, right? Against the risk of doing nothing. And doing nothing, not getting vaccinated, is not a zero risk decision. And so you're absolutely right, though, about it.
Well said. Okay. Yes, please.
We've got
Okay.
a little bit over 10 minutes, so
Thanks, Stephen and Patty. Yeah.
we had a few different items to review here that's related to continuity of operations, but I think that I have to, I'm not going to be able to go over all of them. So, Deanne, I don't know if there's anything that you guys stated that the big news is that the World Arena, the last day for mass vaccination there will be the 27th. We still have a mass vaccination site at the Chapel Hills. We're working to see if we can put something at the Citadel Mall. So we have something on the south side. We're still working with the vaccine consortium and having access points throughout the county. We are highly engaged in the mobile vaccinations and working through trusted partners. We're also in the process of purchasing a mobile vaccination van, at most two, to ensure that we're able to continue mobile vaccinations, working through our trusted partners and putting them in schools or events, you know, in rural communities. So that effort is still going. And Deanne, is there anything else just in the interest of time that you can mention.
One other item I would like to add to the conversation is that since March, we have been in incident command since March of 2020 with unified command with the Pikes Peak Region Office of Emergency Management. And as we see some of the disease metrics decline, as well as seeing some of the demand for these large-scale vaccination efforts, moving more to smaller events and mobile events. We're also at the point where we have the opportunity to ramp down some of our emergency coordination center efforts and allow some of our team members to, instead of being so singularly focused on COVID, really allow our agency to get back to more of a broad spectrum of public health services, which will be very important during the recovery phase as well. So we are looking forward to standing down our emergency coordination center. However, that doesn't mean that we lose our bandwidth or our focus on COVID. That will remain. We will remain in close coordination with our Office of Emergency Management as well as we move into later stages of the response. And along with that, we are also working on after action reports, because certainly when we talk about a response of this duration, there are so many lessons that we can take from this event to inform future activities as well. And as part of that after action process, we're also mindful that this is not just our staff and our activities we undertook, but also the policy making boards and partnerships that informed our response. So we'll be working towards ways in which we can solicit input from our Board of Health members as well to inform those after action reports, and look forward to bringing that opportunity forward to you.
Excellent. I would really encourage board members to go ahead and read through these on the agenda items. The four that I plan to read myself are the four abstracts that were submitted and presented at the Council for State and Territorial Epidemiologists. They're very sciencey. I'm sure that in depth review of these will get deep into the weeds. We're not going to do it today, but it looks like there's been a really significant amount of work that went on there in the area of research. So good job, all these folks. Any other Board of Health member or Susan comments?
No, I would just say that
These are great.
Yeah, I don't think that they're included in the board packet. So what we'll do is we'll send those out through email, but through 2020, we've received a number of recognitions, accolades, and awards and honorable mentions, not at the state level and elsewhere. And Dirk and I are going to be, or the CEO of the Chamber and Economic Development, we're going to be presenting on the national stage, I think in July. But there's as has been mentioned, I mean, we've got a phenomenal team.
This is super.
And there's a lot of recognitions and great work that's going on, just not enough time to relay it all, but we'll send that out.
And can we put it on our website too, these scientific papers? That would, yes, even though they're pre-published?
Yeah.
Okay.
Double check with our team.
If we can do that, that would.
I think that'd be fantastic. If they're
The
solid.
abstracts at least.
They're solid.
Okay, terrific. Anything else, Susan?
I have a lot more, but not enough time, so let's stop there.
Okay. All right. How about though an update on our south site? Could you do that? That's, I think, particularly important. Can you do that briefly, please?
Sure. So our new building, which we have not had for that long. It's Sam Geek had mentioned earlier that there's going to be a resurfacing of and repairing the parking lot, which you guys are aware of that it needed, and the city of Fountainhead agreed to do that. The parking lot has not been free to do so because we've been doing points of dispensing and also testing and very busy in that parking lot. So that will be happening very soon. And we're in the process of doing some lease agreements with the city of Fountain, Police Department, and Mount Carmel. You all are aware that we wrote the grant for the sheriff's office for the behavioral health unit, for an officer to be paired with a behavioral health professional with numerous different partners, UC Health, as well. So there is going to be an effort that is launched out of our south building, which is the Beacon unit, with the Fountain PD. So they will have space there. And we would love to take you guys on a tour at some point. And so the former substation space will be turned into a workspace also for El Paso County staff, because we need more staffing, and we're looking at like hoteling or many individuals using one space, not just a dedicated office. So that will be happening at that building. We do want to plan a ribbon cutting ceremony when things are able to come together, since we have not been able to do that during the pandemic. And the operations team, Melissa, Shannon Ely, Vicki Bennett, I mean, they've been doing a number of different improvements in that building as it relates to just being highly functional and usable. If you remember that there was like an event center, so there was a lot of tool and different things and lights up. And so we're changing some of that. And we're also in the works of working with Fort Carson and the city of Fountain to hold a strategic planning 2-day meeting with Fort Carson, and that would be late October. So there's a lot of efforts that are in the works, and I know that we've done over 20,000 vaccinations in that building. We've received so many, so much positive feedback, whether it's in written form, emails, or verbal, about that clinic is second to none with vaccinations, and people are really, they feel comfortable there, a trusted environment, and that building has been very, very productive for public health and our partners.
Thank you. I'm particularly excited about partnering with Fort Carson to that south building. Anything else for us? There's so much good stuff here. It's in your packet. We'll post it on the website, and perhaps at a future meeting at Sundays, if you want to talk about it.
Yeah, I mean, there's so much, but I know that we still have items on the agenda, so
Okay.
I'm stopping.
Okay. Thank you.
Trying to squeeze